Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Welcome back to Between Two White Coats. How are you today, Amber?
I'm good. How are you? I feel rested.
Oh, I am great because we're about to talk about our very favorite thing in the whole
world. It's
my
favorite.
If you have listened to our podcast at all, you will know that there is a subject that we keep revisiting, not only because it is our very favorite thing in the whole wide world, but also because it matters.
Yeah, it's so important.
We believe that there are 4 pillars of which your entire health is built on: stress management, nutrition, movement/exercise, and the topic that we're going to talk more about today, sleep. We've done lots of episodes about sleep. We've talked about diseases related to sleep, obstructive sleep apnea, insomnia. We've had guests on, Jane Robinson, one of our therapists, talking about different therapies for insomnia. Dr. Juan Lacayo helping us understand obstructive sleep apnea. Interest in those, I would definitely encourage you. Those were great episodes. And then we did, in 2022, the importance of sleep. And I think that was really foundational to help people to prioritize sleep. You have got to realize that sleep is not optional.
Yeah.
Sleep is optional like food is optional. And we live in a society where we it's like sleep is for the weak.
Yeah.
Sleep is for the lazy. And even high functioning people, we're all, we'll sleep when we're dead. Well,
that happened sooner.
Have that philosophy, and you'll get to sleep sooner.
Like, just for instance, like we were like last evening, my family knows like I'm prepping for a podcast, and so I'm looking at notes and make sure. But I was laying down at 8:30 because I knew what today was going to require of me and to be on.
Yeah.
I mean, because I know y'all think, it does kind of come naturally that we can just talk to the wall, but like it's a lot. We're recovering,
But we don't always sound intelligent when we talk to the wall. And today we're trying to sound intelligent.
And so like I knew what was going to be required of me today.
Yeah.
So I went to bed earlier.
You knew you needed sleep.
Yeah.
I think one of the most crazy things, I really tried to teach my son not to be a procrastinator because I was innately a horrible procrastinator. And then when you go to the next level of something, if you haven't been keeping up, it'll smack you. And so I think one of the craziest things in the world is when I was an undergrad and I would pull an all-nighter.
Yeah.
Like,
I used to do that all the time.
I have a huge test tomorrow. I have a big paper due. I'm going to stay up all night and study. Then I'm going to go sit for a test
exhausted
when I have zero cognitive function available. I have not slept at all. My short-term recall, my long-term recall is all jacked up. And I think I'm going to go do well on a test. Even the stuff I studied a week or 2 ago, I'm not going to be able to extract from my brain because it's too tired.
It's too tired.
So you'd be better off just not cramming in those last-minute things and getting a good night's sleep because you can't be on cognitively if you haven't slept.
Yeah.
So let's talk about sleep and understanding it. And this, again, is trying to get people's buy-in so that they all will say what we know to be true. Sleep matters.
And this is going to be
is important.
What I call sciencey, which sounds
obviously. We're going to have a minute of
sciencey stuff, which is a made-up word. But we're going to talk about like REM sleep. So this might like be a little nerdy, but we want you to hear it.
And it's kind of important to understand because you'll understand what's going on in your body during sleep, which will help you to own how important sleep is. So there are 4 stages that happen in sleep. They are broken down between non-REM and REM. The first 3 stages are non-REM sleep. REM means rapid eye movement, and so this is non-rapid eye movement. It is the first stage of non-rapid eye movement is when you are falling to sleep. You're sort of in that twilighty, and you can quickly go, was I asleep? You didn't really get into a deep sleep. You might be more easily awakened during that time. It's really a falling to sleep. You're not in that for very long. Then you go into stage 2 of non-REM sleep, and this is where your mind starts to slow down. This is where your brain starts to be able to relax a little bit. And then you move deeper into sleep, and this is stage 3 of non-REM sleep. Stage 3 of non-REM sleep is often called deep sleep. And so this is when your mind is really starting to shut down. And in all of this non-REM sleep, your body is recovering. You have hormones that are released, like growth hormone. You have all kinds of recovery hormones. So the wear and tear that happens to your body is healing during this non-REM sleep. Sometimes you lay down and you just feel like, oh, I can feel every cell in my body. Today was a hard one. Or you're sore, you feel beat up, your back hurts. Then you wake up the next morning and it doesn't. Because guess what? Your body is fantastic at fixing itself. Yeah. And it will fix itself if you allow it to get into the phase where it should. When you finish the deep sleep of non-REM sleep, then you stage into REM sleep. REM sleep is rapid eye movement and your eyes actually wiggle under your eyelids. And this is where you have your dreams. Also, your body is paralyzed in this time. And that's probably a good thing, because if you're having a very vivid dream that you're running from a bear, you don't need to get up and run in your sleep. So there's no movement in this REM sleep stage. This is where we're dreaming. And about 25% of sleep in adults is in this REM time. This is when your brain heals. If you have been tired enough, you will realize that your brain doesn't work. I've said this before, it's always very entertaining. If you watch very smart doctors after they've worked 36, 40 straight hours, try to sign out their patient load, they can't come up with simple words. There are times where after being a resident doctor and I would work a 36 or 40 hour shift, I would have to, I lived walking distance. I often walked to and from work. And a couple times I had to call my husband so that he could tell me which 2 turns to make on the way home, because I didn't know how to find house. I had walked that for 3 years, but I didn't know how to find our house. And so this is where your brain recovers. One of the things we tell people when they come in and they're getting a little older, so now their memory loss is starting to worry them that it's dementia. And we'll talk about their sleep. Yeah. And sometimes as you age, you don't get as good a sleep, or you're not cherishing your sleep, or you're taking naps during the day and not sleeping as well at night. And just by nature of getting better sleep, you can make your brain work better. Yeah. So this is the important. In REM sleep, your brain heals. In non-REM sleep, your body heals. You should cycle through. It takes about 90 minutes to do this whole stage 1 through REM sleep. And you should cycle through this multiple times throughout the night. Early in the night, you're going to have more non-REM sleep. Later, the second half of the night, you're going to have more REM sleep. So the cycle doesn't take the same amount in each of these from kind of surface sleep into deep sleep. And so this also matters if you don't fall asleep well and then you don't get a full night's rest. You're not going to get the right amount of non-REM and REM sleep. So lots is happening in your body. Lots is happening in your brain. One of the things during REM sleep that's happening in your brain is you release cerebral spinal fluid and it flushes your cells of your brain. This takes the toxins out. Yeah. What we find in Alzheimer's dementia is there's a buildup of plaques and there's a buildup of toxins, and the cells don't heal. And so people who are sleep deprived and not getting either quantity or quality of sleep are going to end up having these diseases like dementia at earlier ages, and maybe they wouldn't have had it if they were able to have restorative sleep. Yeah. I think there's a great, if you're really needing sold more on the importance of sleep, Dr. Peter Attia's book Outlive, chapter 16 is all about sleep, and it is great. And he says that he and a friend of his said, if sleep is so unimportant, why hasn't evolution selected against it? This is the time when we're vulnerable. This is the time when we could be eaten by animals. If it wasn't necessary, we would have got rid of it by now. Over thousands of years, we would have got rid of it by now. It is super necessary. And so the quality of sleep is that you have to go through each of these different stages of sleep. And if you're missing REM sleep, your brain's not going to be what it needs to. And if you're missing non-REM sleep, your body's not going to heal, and you're going to have all kinds of other issues, diseases and injuries and all kinds of other things happen from not going through this. So it's not just about quantity. We really can speak about quantity of sleep. And before, we'd always know I went to bed at this time, I woke up at this time. But now, thanks to our mobile devices and other things, wearable devices, we can also see, are we getting quality of sleep? And that matters a lot. And when we talk about quality of sleep, I really want to point out every sleep aid that we have that is approved for insomnia destroys your quality of sleep. That is a big deal.
Yeah.
So when people come in and they're like, I need Ambien, I need Xanax, I need a benzodiazepine, Valium, whatever else, it changes to where you don't go through the non-REM sleep correctly, you don't go into REM sleep correctly, and you don't get quality of sleep. So just know, if you are substituting good choices with a prescription sleep aid, you are ruining the quality of your sleep. Yeah. And you're still, it is going to put you at risk of things like dementia and heart disease and diabetes and metabolic disorders when you don't get quality sleep. Let's talk. So that's sort of what sleep's supposed to be while you're unconscious. Let's talk about quantity of sleep.
Yes. So I have pediatrics kind of as my,
you see a lot of our kiddos.
Yeah. And so I get that question a lot, like how much should they be sleeping? And I have teenagers and I feel like they can sleep all the time. And I am definitely like just personally and from a medical standpoint, like the circadian rhythm, which is, we haven't mentioned yet, but circadian rhythm in teenagers is a little bit different. They actually, their set point is later. Yeah. So, you're like, I mean, my kids put me to sleep, to bed most of the time now because I want to be in the bed. I mean, definitely
tuck you in, say goodnight.
They come in and both, I like text
Stay
them.
Up for 4 more
I literally
hours.
text them because I'm so lazy. And I'm like, please come tell me goodnight. And they come in and like, they'll kiss me and do all the things and like, all right, mom, good night. And then,
but you're absolutely right. Where we think our teenagers are just
trying to be away,
wanting to do something they're not supposed to. Their set point is a little different. So they want to go to bed later and they want to get up later.
Yes. So so it actually is around 11 for teens. And so my children are athletes and we are a busy schedule and they have homework. And so we do attempt like by 10 if we're home for them to be in the bed. But I also let them sleep in. And there's a lot of studies about allowing children to take naps when they come home from school, even if it's like a 30 to 45 minute nap, because they are growing and those growth hormones, like you mentioned, are, especially during pubertal years, like it's surging and they need more sleep. Yeah. So I am not like, make your teen get up at 9:00 on Saturday. Now, if they have to do something, that's one thing, but I'm completely fine with letting kids sleep.
And many times, if you're hungry, it's your body saying you need some nutrients. And if you're sleepy, it's your body saying you need some rest and recovery.
There is something to be said, like if you're concerned about your teenager being depressed, like that is different.
Yes.
Because depression can cause you to be more fatigued and you feel tired all the time and you want to get out of the bed.
And if every day people are sleeping for like 4 hours in the middle of the day, different story.
Different
but
story.
If it's like, wow, I know you were slam busy this week and you want to take a great big long nap, let them have the nap. It's their body saying this is where we get better.
Yes. And then from the American Academy of Pediatrics, it varies in age, but from like 4 to 12 months, so you're under 12, it's about 12 to 16 hours a day. This is including naps. 1 to 2 year olds are 11 to 14 hours, including naps. 3 to 5, 10 to 13. 6 to 12 is 9 to 12 hours. And then teens are 8 to 10. So you see it's still more than what we think is recommended as 6 to 8 for adults. Like kids just require more sleep as they should. And they need consistent bed routines, especially littles. And then they have the developing brains. And then one thing that we really haven't dived in, I don't know what I just said. Anyways, for like infants with SIDS, like the risk factor of just, that's sudden infant death syndrome. Yeah. It's legit. It's extremely scary. It's probably one of the things that I talk to parents. So tragic. But sleeping patterns matter. And for infants, like SIDS is a risk. And so things like putting your infant back to sleep on their backs and not having things in the bed with them, make sure the temperature is cool, cooler.
Keep things away from
the baby's heads. Yes. If they're on having tummy time, that it's supervised, and not letting them sleep in car seats or strollers. So those are kind of like just little bullet points for pediatrics. But kids essentially require a lot more sleep. And it's mostly because they're growing, and that's when our body is healing. And teens, I love teenage patients. They're my favorite because by far they are the most hilarious, and I can be the most sarcastic with them because they'll just banter with me. But they require a lot of sleep, and sometimes I'll have parents that are like, well, they need to do that. And I'm like, honestly, let them sleep.
Yeah. And then they love you.
And then they're like, yes, Miss Amber, thank you. But they do need it. So
yes. And so we've talked about really what's happening in your sleep. We've talked about you need quality of sleep, the quantity of sleep. For adults, you said 6 to 8, some say 7 to 9. I really feel like it's around that 7 or 8 hour mark is what most everyone agrees with, is how many hours of sleep you need. And a lot of people, I think, are struggling with sleep because we think we can be on our device until we fall asleep. That is not good for you. You need to put those devices away. That blue light that comes off of all electronics is very stimulating to our brains, and we really need not that for at least an hour before we're laying down. We need to not think I can do all these things and exercise and do the laundry and then watch the horrible news of all the things that are broken in the world and then lay down and sleep well. That's just not how it happens. So we need to have good sleep hygiene and really prepare ourselves to get a good night's sleep. But we also need to take ownership for the fact that a lot of diseases, a lot of sickness happen when you're not sleeping well. And we know metabolic diseases, things like diabetes and hypertension and heart disease, are really either caused or made worse from either poor quality or poor quantity of sleep. Dementia is going to be caused or made worse by poor quantity or poor quality of sleep.
And one thing that I think when I'm sitting with patients, like, not that, like, they're almost like shame. I feel like they feel shameful or guilty when they're like, well, I am on my phone and those are things we need to know, because if you're asking me for something to put you to sleep, like that's often what we hear, like I can't go to sleep, or I'm not sleeping through the night because I'm getting up to go to the bathroom, or there's another reason that's disrupting their sleep. They have a new baby or menopausal and they're having hot flashes. Like often sleep disruptors are something else is going on, because your body is made to sleep. So like if you are needing something for sleep, then I need you to, let's say, okay, are you following consistent routines? Are you practicing good sleep hygiene? Because often it's an easy fix.
Yeah.
And the easier fix is not a pill.
Yeah.
The easier fix is actually doing what you're supposed to. And so sometimes people, I don't know, like they're talking about sleep is a very interesting thing, because then I'm asking questions and they're like, well, no, I don't do that. And then they feel like they're guilty or shamed, and that's not what I want it to be. I want it to be an open dialogue conversation that we can say, hey, why don't you try this, as opposed to me just giving you a pill.
Right. Absolutely. And I think the other things that's really important to remember of what can even be caused, what can screw up sleep, but also screwed up sleep can cause is mental health disorders. Yeah. Depression, anxiety, even psychosis. One of the interesting things is if sleep deprivation is a form of torture in wars, and holding someone awake for 3 or 4 days induces psychosis, visual and auditory hallucinations. Like it really screws up your brain. And so if a person is not sleeping, they're going to end up with a screwed up brain, and it's going to really cause depression, anxiety. We know that it causes us to be less loving and patient people. You can really be on edge when you're not well rested. I had a situation when we had our son. He had sleep issues. He couldn't sleep on his back. I was really like
panicking.
SIDS and other things were sleeping on the back, and he just didn't sleep well at all for 6 months. And I almost took myself to a neurologist because I started stuttering. I was word searching so much. I was like, I have a brain tumor and I've just had a baby and I'm going to die. I just knew something was wrong. And then I was like, step back, step off the ledge. What do you know? Get a good night's sleep. And so I just disengaged for a night. I said to my husband, you've got to take care of Colwyn for the night. And I just got to sleep for 8 hours. Next day, no issues whatsoever. But I was so sleep deprived repeatedly that I was starting to have neurologic issues. It absolutely will have a profound impact. I think our takeaway messages are recognize that quality and quantity of sleep matter. You will not be okay. You will not be in good health if you don't value these things. So first of all, put a value to it and continue to protect it. Just like you're saying, hey, I'm going to bed at this time because I'm going to get my 7 to 8 hours, and you protect it. Make sure that you are tracking your sleep, pay attention to it, whether you have a device that does that or whether you're just really protecting the hours. Make sure that you are sleeping in a cool room with darkness. You have good sleep hygiene. Stop your caffeine. Probably from noon on, you should not have caffeine. Be careful of taking naps during the day. If you're doing it, you'll get yourself into a bad cycle if you don't sleep at night and then you take a nap and then you're not tired the next night. So sometimes you have to push through and leave yourself a little tired so that you can be tired at night. Remember that waking up with the sun helps the circadian rhythm. 5 minutes of sunlight when you first wake up goes, it's time to wake up, and the serotonin starts. And then at night, it has to be dark, and not just dark in your bedroom, but dark for hours before. Start dimming the lights and taking away the light so that you can start recognizing it's time to rest and your melatonin kicks in. These are all really important daily habits to help us protect our sleep. But please have the priority of protecting your sleep. All the other stuff that we do to try to take care of ourselves, the medicines we take, the exercise we do, the nutrition that we're trying to focus on, none of it really matters if we're not sleeping.
And have a conversation if you're not sleeping. Like, if there is a reason, then, or there may be a reason, I should say, and talk to your healthcare provider about it if you're really struggling with sleep.
Yeah, prioritize this and get help if it's not going well for you, because it is absolutely the foundation for the rest of your health. Thank you for joining us today. We appreciate you hearing about sleep. We hope that you will get a good night's rest tonight.
Maybe we put you to sleep by listening to us about sleep.
Yes, turn this podcast on tonight and see if it helps you rest. So thanks again for joining us. And until next time, take care of yourself. We like to leave you on a good note. So here's today's Tell Me Something Good. Something good is change. Change can be scary and hard, and we often try to shy away from it. But many times when we are brave and we make a change, it really leads us down the right road. So be brave, and if there's something that needs changed, go for it. Thanks for joining us today, and until next time, take care of yourself.